I'm Dr. Emerson, an internal medicine doctor at the Guam Seventh-day Adventist Clinic. Here's a message for your health now. Let's talk about heart disease, particularly heart attacks. Heart attacks are one of the leading causes of death worldwide. Are there alternatives to surgery and drugs for treating heart disease? Let's ask the man who solved the riddle of how to reverse heart disease. Who was he? He was Nathan Pritikin. Surprisingly, he wasn't a doctor, he was an engineer. So how did he get involved in heart disease research? Well, in 1955, he had his treadmill stress test, which showed he had severe coronary artery disease. Cholesterol in the blood was just being shown to promote heart disease. His was very high at 280. At that time, they couldn't give him much hope, and so they told him to get his affairs in order. He could die at any time. Was he discouraged? He was not. He did not give up. Instead, he started poring over the medical literature for a cure. He found that researchers had just shown that high amounts of cholesterol in the blood could be deposited in the walls of the arteries supplying the heart. This deposited cholesterol, called plaque, could restrict the flow of blood in the heart, causing pain. It was later shown that as the plaque ruptured, it could completely shut off the blood flow to a part of the heart, resulting in a heart attack. That is, death to part of the heart, and if that part was large enough, death to the person. Pritikin believed that if he could lower his cholesterol enough, he could remove the plaque from the arteries, thus opening them up to stop the chest pain and prevent a future heart attack. From 1964 to 1966, he experimented with his diet. He arranged with his physician to check his cholesterol every 2 months, and he would try one diet after another. Finally, a diet mainly of plants lowered his cholesterol the most. What did that diet consist of? Well, mainly plants, such as legumes, which include beans, peas, lentils, and chickpeas. Grains, which include wheat, rice, corn, oats. It also included fruits, nuts, and vegetables. He also excluded all oils, such as salad oils, fried foods, and foods made with oils. Did the diet work? Well, in 1966, after being on the diet for many months, he had a repeat treadmill stress test, and it was normal, showing that his heart disease was now undetectable by this test. By 1984, his cholesterol dropped from 280 down to 94, which was very low. After his normal treadmill, he believed heart disease was reversible with a plant-based diet, which mostly avoided meat, dairy, and free oils. He now needed to convince the medical community with a controlled trial. In 1975, he placed patients with severe heart disease in a rented house and fed them mainly vegetarian food without free oil. The men complained at first, but after a few weeks they stopped complaining. Their chest pain and leg pain had gone away, and their ability to walk improved markedly. The Seventh-day Adventist Medical School in Loma Linda, California, did before and after cardiac angiograms. These are x-rays of the heart designed to show plaque in the heart arteries. These angiograms showed that within a year, the coronary arteries were opening up. But no one would publish it. Pritikin wasn't a doctor. He wasn't part of the medical community. Undaunted, he established a longevity center in Long Beach, California, where patients came from all over the world to receive plant-based diet, hear medical lectures, have cooking classes, and start an exercise program. A television show which exposed fraud called 60 Minutes believed he was lying to these people and robbing them. But when the patients were interviewed, they told how much better they were feeling. Then when the reporters heard the medical lectures showing the evidence for plaque disappearing from the arteries with a plant-based diet, they took a different approach. The TV show sponsored 3 heart patients to attend the program. They hired a cardiologist to evaluate them before and after the program. The 60-minute team followed them through the program. The results? The men's symptoms resolved. The cardiologist confirmed that they had improved markedly. After it aired, the phone lines to Long Beach, California were jammed by people calling, trying to get into the program. How did the medical community respond? Well, 1 year after the broadcast, the medical community published an article saying that anyone would feel good with a 2-week vacation, but that it wouldn't last. 60 Minutes TV show, they heard about it, and they said, well, let's find out. So they re-interviewed the same 3 men, all of whom were still doing very well. The cardiologist's reevaluation also showed them doing very well. When it aired on national television, again, the phone lines to Long Beach were jammed with people trying to get into the program. He was finally asked to speak at a medical convention, but instead of talking on the side issue they had suggested, he gave them the evidence for reversal of coronary artery disease with a plant-based diet. When he finished, there was dead silence. He again thought there was no interest. However, in the break that followed, he was inundated with questions from eager listeners. In 1985, at age 69, he died of an unrelated cause. An autopsy was performed by a pathologist who did not know his identity. He asked where this man grew up. When they told him Southern California, he said, no one in Southern California has clean arteries without plaque like this man. Shortly after his death, the most prestigious medical journal in the United States, the New England Journal of Medicine, July 1985, documented the severe heart disease that he had diagnosed in 1955. It reviewed his lifestyle change to a plant-based diet, one that was oil-free. It reviewed the autopsy report, which showed that his coronary arteries were soft and pliable and widely open throughout, like a newborn baby's. This was in a man who 30 years earlier had been diagnosed with severe coronary artery disease. Later, Caldwell Esselstyn, a medical doctor, started reversing heart disease in inoperable heart patients using a vegetarian, no-oil diet. He documented it with before and after angiograms. It was published in several peer-reviewed medical journals. Finally, in 1990, Pritikin's 1975 study was repeated by Dr. Ornish. It was published in the medical journal Lancet. It demonstrated the regression of coronary artery disease using a plant-based diet. It was a prospective, randomized control study involving 48 patients, 195 coronary lesions run over a year. Statistically significant results were obtained even with this relatively small group. It shook the medical community. Prior to Pritikin's death, he was asked to speak at the Seventh-day Adventist University and Medical School in Loma Linda, California. He said that he had read the books by Ellen White, who was an early pioneer of the church and who I believe had special insights from God. These books were written over 100 years ago. Pritikin said he had read these books and that we had a gold mine of information in her books. He encouraged us to move forward and start sharing it with the world. So now you can live with all your heart by eating a full plant-based diet. Consider using almond milk, soy milk, or rice milk in place of the dairy products. Use legumes for your protein instead of the meat products. Use foods rich in healthy fats like olives, avocados, and nuts instead of the free oils. Add to this fruits, grains, and vegetables, and you have a truly heart-healthy diet. Thanks for watching. May God bring you hope and health now.